Does your child seem to experience emotions on overdrive? Irritability that feels constant, outbursts that can be shocking, or meltdowns that leave everyone feeling drained? Parenting a child with big emotions and challenging behaviors can leave you feeling lost, frustrated, and even alone. But what if there's an explanation behind it all? Today, we're diving into Disruptive Mood Dysregulation Disorder, or DMDD, a condition we talk about a lot here, and one that might hold the key to understanding your child's struggles. Tune in for some practical tips, some actionable steps, and the support you need to navigate this journey. Welcome to Calm Connection Parenting. I'm your host, Jamie Kirkbride, mom of 7, parenting coach, professional counselor, and wrangler of big emotions. If you're raising a highly sensitive child with intense emotions or challenging behaviors and wondering if you'll make it through without losing your mind, you're not alone. Around here, we're all about real-life parenting, sprinkled with a little humor and a whole lot of patience. So grab your coffee, trust me, you'll need it, and join me as we explore tips, stories, and faith-based strategies to help you bring more calm and confidence into your chaotic days. Let's do this. You may be searching for answers to the excessive anger and emotional reactions, maybe the chronic irritability and severe meltdowns that your child is experiencing. And maybe you're finding words like mood disorder or disruptive mood dysregulation disorder or DMDD. Mental health information is thankfully growing on this topic. Today, I want to share what you need to know about DMDD. You'll get a simple glimpse into the disruptive mood dysregulation disorder symptoms, some criteria for diagnosis. We'll talk about some treatment ideas and a couple tips for navigating this diagnosis with your child. First things first, you're probably here because you were familiar in some way with emotional dysregulation. A child that shows excessive anger, issues with anxiety or mood disorder, depression, maybe even just something more than ADHD, but you can't quite put your finger on it. Or it might be some other mental health issue I haven't mentioned. I just want to let you know that the information shared here is not intended to replace seeking medical attention. In fact, I encourage you to seek informed medical attention. I'm not going to offer advice on medication or diagnose. I'm simply sharing with you what we have learned in our journey of child mental health. From my mom's perspective. Yes, I have a background as a counselor and I work as a parent coach, but I'm sharing with you today so that you can know mom to mom what some of this might look like. And when you know this information, it can allow you to discuss concerns with a medical professional, to have a basic understanding of some of the issues your child faces, and help you be prepared to both ask and answer questions that other professionals may ask. Parents often enter this discussion using words like tantrums and meltdowns, but then quickly realize that we're discussing behaviors on the extreme end of this spectrum. DMDD would be recognized as severe tantrums, severe meltdowns. There's a high likelihood that it's impairing functioning at home, school, with friends, or a combination of those. You might find some people are quick to focus on the behavior and think that it can just be punished away. But it's more helpful to imagine these severe meltdowns as communication. This child may be experiencing a full body overwhelm to something that they're struggling to process or understand. Maybe they can't even express it. They may not even have words for it. But this child is feeling a threat in their environment. And it may be something that's happening, something they are feeling, or something that they're just simply unable to process or explain. This perceived threat is what sets a certain part of their brain, the emotional control center of the brain, called the amygdala, into action. These responses that they show are beyond typical tantrums or meltdowns. They're severe and intense versus the normal age-appropriate meltdowns. They include full-body responses with excessive mood, big emotions, physical reactions. They may be evidenced by even seeing the child's pupils dilate, their jaw clench, their nostrils flare, a defensive stance or posture, possibly even the baring of their teeth, loud verbal responses, and sometimes you'll even notice what appears to be a super strength when they're angry. As a result of these intense meltdowns, you and your family are experiencing significant upheaval in your home, and consequently, the relationships that you all share as well. So keep listening for some suggestions that I'm going to share with you to help ensure safety during these meltdowns. Now, you may be researching for answers or trying to seek help for your child and discovered DMDD this way. You may have heard DMDD referred to, especially since we mention it a lot here, and not even known what those letters stand for. So let's start there. DMDD is an abbreviation for Disruptive Mood Dysregulation Disorder. The National Institute of Mental Health defines it this way. Disruptive Mood Dysregulation Disorder is a childhood condition of extreme irritability, anger, and frequent intense temper outbursts. DMDD symptoms actually go beyond being just a moody child. Children with DMDD experience severe impairment that usually requires clinical attention. Understanding of DMDD has changed over time. Thankfully, it is beginning to be discussed, understood, and even better treated. One of the most accurate ways DMDD has been explained likens it to having your child's fight, flight, or freeze response functioning in an overreactive way. Now, not only is their response to threat overreactive, but it's almost as though it gets stuck. When it is kicked in, the frontal lobe, which is the decision-making part of the brain, cannot function as well. In other words, they can't really be reasonable or rational. It can really impair a child's ability to function at school, to make social connections, and to form positive relationships even with their very own family members. It can complicate or sometimes keep them from forming friendships, and for some even being involved in activities. What might a parent notice if a child is considered to have issues with DMDD? Well, as a parent, you would probably notice that your child is chronically irritable. Numerous things in their day cause them to feel extra upset or even erupt. But more than likely, the default setting looks pretty low, frustrated, and hard to please. You would probably be experiencing several intense meltdowns or rages per week, and for some, even in a day. The meltdowns would be intense, and they could be aggressive verbally, physically, or both. They might include hitting, kicking, biting, insulting, cursing, possibly threatening others, breaking or destroying things, maybe even running or hiding, attempts to run away, or threats to harm themselves or others. The eruptions usually happen after some small incident that many other children would just overlook or have a minimal response to. These responses seem out of proportion both to the thing that happened as well as to the response you would expect from a child their age. Now, I know labels may feel frustrating to parents, but the medical community usually uses this criteria in order to uniformly begin to treat and monitor change in the people that they work with. And it's important to know that in 2013, they added DMDD as a diagnosis to the Diagnostic and Statistical Manual, otherwise DSM-5. And this is the criteria that doctors or treatment providers will usually look for. Severe recurrent temper outbursts manifested verbally and or behaviorally that are out of proportion in intensity or duration to the situation that happens. The temper outbursts are inconsistent with developmental level. The temper outbursts occur on average 3 or more times a week. The mood between temper outbursts is usually irritable or angry most of the day nearly every day and is observable by others like parents, teachers, peers, whatever. These things have been present for 12 or more months, and they're present in at least 2 of 3 settings like home, school, with peers, and usually severe in at least 1. The diagnosis should not be made for the first time before 6 years of age. Why? Because typically before 6 years of age, a child is throwing tantrums or having meltdowns anyway. And so if we're going to compare to something that is more age appropriate, we have to let them age through a little bit. Usually by 6 years of age, those meltdowns start kind of going by the wayside, but not so for a child with DMDD. In fact, they may even escalate. And they're usually not diagnosed after the age of 18. Usually the age of onset is before 10 years of age. And it's helpful to know this criteria when you're seeking help for your child. So you might even look that criteria up online and take it with you if you're suspecting this might be an issue with your child when you go to talk to a doctor. Now, because this is a newer addition to the DSM-5, it's important for you as a parent to do your homework. I admit, having been in private practice as a counselor before, and during the course of my counselor education, I had never even heard about DMDD nor worked with it. And I can tell you that there are probably many medical and mental health professionals who have not. So please do your research and know beforehand if your doctor or counselor is familiar with the condition, or even willing to do some research just to learn more about it. If you're concerned that this might be what your child is struggling with, please take time to view the Dr. Larry Fisher videos on YouTube or look up rdmdd.org. Here you can find information both for parents and professionals. You can see the extensive studies and the amazing finds in this area. When you're armed with this information, you will be the one to ask your doctor if it is a possible fit for your child, and that is okay. So that 5-part video series might seem a little scientific, but there's some things in there that are very informative. And it may be that you visited a doctor or a counselor, and maybe one of them brought this up as a possibility or a probable diagnosis for your child. I still encourage you to read, study, and learn. Visit the rdmdd.org and find the information there that is specific for medical professionals. Maybe print it off and take it to your doctor or send them the link. But it's a great place to refer a doctor or counselor who might be new and willing to learn. It's important to know that there's some common misperceptions with DMDD. One of those is that sometimes kids end up with a diagnosis of DMDD and ODD, or oppositional defiant disorder. It's important to know a child can't be diagnosed with both. While they may carry some significant similarities, the motivation of the behavior is very different. In oppositional defiant disorder, the goal of the behavior is usually aimed at defying authority. But it's different with DMDD. Often an intense emotional outburst might include physical or verbal aggression that may be inadvertently involving authority, but oftentimes this child can't even remember what they said or did. And sometimes they experience some real upset, even to the point afterwards of self-hatred or thoughts of self-harm because of what happened. So it's not that targeted defiance at authority. There may also be some overlap with some other mental health issues, such as anxiety, depression, ADHD, sensory processing, and executive functioning issues. Some of these children are even showing abnormal brainwave activity. So it's beneficial for you to do your research and understand the different features of these issues and which ones might indeed overlap for your child. And it might explain how an original diagnosis for something like ADHD can almost appear to morph into something more like DMDD as a child grows. Now, there's more I want to share with you, but first, I'd like to share this message. Parenting a uniquely wired child can feel isolating, right? While other parents are talking about typical tantrums and bedtime battles, you're navigating emotional meltdowns, sensory overload, or challenging behaviors that many people just don't understand. It can be frustrating when the advice you hear just doesn't fit your child, and even harder when you feel like you're alone in the journey. But here's the truth. You don't have to settle for just surviving. In the Calm Connection Parent Coaching Program, I'll help you understand your child's unique wiring and give you faith-based practical strategies to not only manage the emotions and challenging behaviors, but actually help your whole family thrive. With video course, workbooks, a supportive community, and weekly coaching calls, you'll get personalized support every step of the way. If you're ready to stop feeling alone and start finding real solutions that work for you, your child, and your family, then visit calmconnectionparent.com to learn more. Together, let's move you from surviving to thriving. Let's do this. You may be wondering what you can do to help a child who's been diagnosed with DMDD. You might even be curious, like many parents that I work with in my coaching program, that say, well, is there a medication for anger outbursts? There are a number of ideas for treatments and a whole host of medications that doctors may work with. But you will be faced with many decisions about medication therapies, sometimes even to the extent where you have to consider care within a hospital. And these decisions can feel overwhelming and often get made in the midst of the turmoil or in an emergency. So that's another reason why I really reiterate to the parents that I work with to do your homework, have a plan for times of crisis, know the symptoms your child is experiencing, and really just start being a student of your child, his triggers and his responses, what calms him, what works, what doesn't. Because DMDD is a newer diagnosis, they're establishing these standards of care. That means there may not be a typical course of care that all doctors are aware of or that has been established in the medical world. In fact, some of the prescriptions being used may even be considered what they call off-label, which may indicate that maybe the FDA has not necessarily approved it yet for that particular disease or disorder. So there's some differing opinions on medications, and you may find that when you visit doctors. And there's not always hard and fast answers to the course of treatment for DMDD. But there are some methods of treatment that are proving very successful, such as the protocol mentioned in the Dr. Larry Fisher videos on YouTube and at rdmdd.org. And honestly, it's bringing many children and families some incredible change and relief. As a result, many families are being helped and changed. One young child, after being put on the protocol that they talk about, remarked, "For the first time, my life doesn't feel so hard. My thoughts about wanting to be dead are all gone. It's like a miracle." If medications are chosen, they may choose a combination that might include a variety, such as anticonvulsants, antidepressants, stimulants, anti-anxiolytics, sleeping medications, or others. But learning about the different classes of medications, what they do, and even how they might interact can be a pretty big task. This is another reason it's imperative that you become both a student of your child and their behavior, as well as the possible medications and how it might change their health. The videos that I've mentioned address some of these specific medication concerns and questions, but I'm going to leave the rest of that for the medical professionals to address. But I want to alert you that not every doctor will be aware of the advances in this diagnosis. Maybe they haven't even treated it before and they aren't aware of useful treatments. If you haven't already, you will quickly learn that you will have to be an active driver and diligent advocate for what your child needs. Your child will benefit greatly if you sharpen those skills necessary to speak up. It might even take questioning those who are professionals and being persistent to get the information or the action that you feel you need to take for your child's best interest. And I want you to know getting a second opinion is perfectly fine. try to become more comfortable talking through even the tough and embarrassing stuff. You may feel like you're outside your comfort zone. I remember feeling that way with professionals as we dealt with child mental health issues. But this is where you may need to learn to be more confident and comfortable for this journey. Now, there's many different treatment options that you might consider, including medications, supplements and vitamins, family therapy, individual therapy. Some utilize neurofeedback or other computer programs, chiropractic or naturopathic care, occupational and/or physical therapy, parent education, and one of the forms that they talk about being most successful, CDBT, or another specialized therapy. Now, it's helpful to remember that your child will usually gain the most from therapy when they're more stabilized. When their brains and bodies have become a bit more balanced, they will be better able to make changes and implement the tools and strategies that they learn so that they can be more successful. Now, I want to tell you this. Oftentimes, parents are referred for parent training or education. And I know it can feel insulting if you feel that that recommendation comes with an assumption that you don't know what you're doing, or that you are the problem, or that you are the one that needs help as opposed to your child. But I want to help you frame this differently. You are parenting a child that needs to be helped, handled, and understood in ways that are very specific and different than usual parenting. This may be different than dealing with a neurotypical child and even your other children. Learning specific methods, tools, and tips can be a huge asset to this new and challenging journey. So I encourage you to embrace the help. And the truth is this: you can only control what you do. You can't control your child. So engaging in learning things that you can control is a powerful piece to changing things up. You may find individual counseling or parent coaching helpful as you learn different strategies to both calm yourself and help your child learn to regulate in the process. Raising a child with these needs can be very exhausting and overwhelming. Seeking help is not a sign of weakness. Rather, it's a sign of strength. And knowing that receiving help can allow you to be more effective in assisting your child. I know even as a mental health professional myself, I found useful support and even learned some strategies by seeking help as well. In addition to help, you will need support. The journey may be harder than any road you've ever traveled before. At times, your child's treatment of you when they're emotionally dysregulated may almost feel like an abusive relationship, except it's with your child, and you're unable to walk away from your child. So realize the depth of the needs, the hurts, and struggles for your child, for you, and your entire family. Give yourself and your child a lot of grace for the journey. Along with grace, I encourage you to bathe yourself in some very consistent support. Now, there are some excellent support groups online, some of which are DMDD support, Parents of Children with DMDD, and Matthew's Kids, which pertains to the specific protocol that was mentioned earlier. And these groups are on Facebook and can assist parents in learning more about this mental health diagnosis and how it differs from other diagnoses. In the safety of these groups, you will find others who are living a reality that is similar to yours. You can talk about things that you're experiencing that oftentimes feel like taboo topics in other parenting groups. Others' experiences and their input can be a great way for you to learn and also help you as you speak with professionals. Reading other stories might even help you realize that there are those who are in a better place and those who are in a worse place than you. And most importantly, you'll see that you are not alone. You'll find others who are journeying ahead and offer hope for where you're headed. The help and the knowledge that others share can be a wealth of information from those who know this very thing best. Those who are living, learning, and loving their child through it. For those of you who are on this journey, you may often feel alone. And I want you to know there are others who understand and can appreciate the heartache and the pain that you've experienced. Maybe this poem that I wrote several years back and shared in a support group can bring you a glimmer of hope on the hard days. It's called Hope for Invisible Disabilities. They see my child with a quick glimpse or two, then watch from a distance to see what I do. They notice he's loud, mad, and blowing a fuse, then quick with their judgment for what he will choose. It's an invisible disability, lacking what others appears emotional stability. Behind what looks normal, they'd never guess, nor would they take time to fully assess. They don't know the anger, fear, worry, or dread, or even his sad, truly solemn wish he was dead. While other kids play outside at the park, he spends his time fighting a way out the dark. Appointments, interventions, all carry a price. Hopes of finding some relief, that would be nice. No matter how hard he works and he tries, at the end of many days, he falls and he cries. There's desperate attempts to try and belong, hard lessons and struggles with friends to get along. We role play and practice and give it our best, but fail to see others stand the same test. Slow steps of progress are often not seen, feeling broken, tired of trying, or something between. He says others hate him. I assure him they don't. He screams he hates me, and I pray that he won't. Quite certain I'm not built for this difficult course. God, grant grace for this journey. Your love is our source. Aid others in understanding the burdens he bears, and give me the words for the hard thoughts that he shares. Help us capture his heart in a real, true way. Guide and support us through each tough day. Whisper his name when I can't be near. Remind him he's loved, truly valued, and dear. Place your guardian angels along his way. Give him true hope and joy until a brighter day. Maybe this poem speaks to your heart. I want you to know, if it does, you can get a copy of this poem at calmconnectionparent.com/resource. Now, I just want you to know you're not alone in this. And just like there were really dark days in us walking through our child's mental health issues, things don't stay that way. We were able to find strategies and help and support, and could be in a very different place, so different that that's how I was able to develop this program that can help other parents that are walking similar paths through child mental health. Perhaps you're looking for some practical help and resources as you start or maybe continue your journey. Well, you might find the meltdown video on the Parenting with Personality app or the YouTube channel helpful if your child is struggling with meltdowns. The tools in that video can help you navigate making a safety plan and identifying some of your child's triggers. In this way, you might be able to anticipate and plan for your responses. You might be feeling a bit overwhelmed and wondering what your first steps might be. Here's some ideas where you can begin finding help. Again, the meltdown video, the planning form and trigger list on the Parenting with Personality app or on YouTube. Watch the Dr. Fisher videos on YouTube. Join support groups online, and a shameless plug for Parenting with Personality Facebook support group, where I would love to catch up with you and offer support there. Seek medical professionals about medications or diagnosis and see rdmdd.org to find that information. Look for support, practical resources, and maybe even coaching for these parenting challenges. Decide when and where you might seek counseling or therapy for your child. But I also want you to know it's important for you to learn how to identify your child's triggers. Understand their sensory processing issues that may be contributing to the dysregulation, and make a plan to handle your child's intense meltdowns. Making a plan with your child can help you understand what your child might need and how best to protect everyone involved, including siblings. Now, here are a few additional tips for safety when your child is emotionally dysregulated with these severe meltdowns. Truly avoid trying to reason or discuss things with them. They aren't capable in that moment. Their frontal lobe isn't working, and it will be of no use. Assume a safe and non-threatening posture. If at all possible, try sitting a little distance where you're close enough to keep them safe, but not touching them. You might even offer a cold glass of water in a plastic cup in case it gets dropped or thrown to stimulate their nervous system. Remember to keep your words few, calm, and quiet. Clear the child to a location apart from others. And if your child isn't able to get up and move, remove others from their environment so that there's less stimulation. And limit other stimulus as well, such as the sights, the sounds, touching, smells, and movement. And avoid touching the child if at all possible, unless you must restrain them to protect them or someone else. Restraining really is best as a very last resort because oftentimes this causes this child to dysregulate even further. But I want to point you to some other useful resources from Parenting with Personality. I encourage you to visit parentingwithpersonality.com to get your free Chaos to Calm cheat sheet and learn about the supportive and educational resources available to help you on this parenting journey. As I mentioned, join the Parenting with Personality Facebook group to find support, practical tips, useful information, and a community of like-minded parents on similar journeys. And in that group, you can also learn more about the Calm Connection Parent Coaching Program that's designed to help educate and support parents who are raising a child who's highly sensitive, emotionally intense, or exhibiting challenging behavior. So if you're needing someone to help you make sense of your child's unique wiring and issues, this can help you put those pieces of their puzzle together. This can be a difficult and even heartbreaking journey to travel with your child. Please know you don't have to do it alone. My heart's desire is to help parents experiencing this stress and struggle to find their calm, confidence, and connection with their child. I'm here for you and I'd love to connect. I know you can do this. As we close today's episode, I want to remind you of something very important. You were chosen to parent this uniquely wired child. This precious, extraordinary soul was entrusted to your care because God knows your heart and your capacity to love, even on the hard days. The challenges you face may feel overwhelming, but you don't have to do this alone. He will equip you for each step of the journey, providing strength, wisdom, and grace when you need it, so you can build the calm, connection, and even joy that you and your family desire. So please share this episode with another parent who could use the support, or even a family member or teacher or other caregiver who might need to understand your child better. I'm here for you. I see you, and I'm ready to help in any way. I'm sending you care and prayer for every step of the journey. Thanks for hanging out with me today. Just remember, you've got this. And on the days you don't, well, we're in this together. Take a deep breath and keep building those heart-to-heart connections. If you found this episode helpful, please share it with a friend who might need it too. And don't forget to connect with us at parentingwithpersonality.com or in our Parenting with Personality Facebook support group. We'd love to continue supporting you there. Until next time, keep calm and parent on.